Nasal hemangiomas. Fascinating yet tricky vascular tumors, right? They're benign, but their location in the nasal cavity can make them a clinical challenge.
So, what exactly are they?
Hemangiomas are abnormal proliferations of blood vessels. In the nasal cavity, they're often capillary or cavernous types. While capillary hemangiomas are more common in younger patients, cavernous hemangiomas tend to present later and can be more problematic due to deeper tissue involvement. Now, let's talk presentation. Patients usually show up with nasal obstruction, epistaxis, and sometimes a visible mass if it's anterior. The tricky part? They can mimic more aggressive lesions like angiofibromas or even malignancies. Diagnosis? A combination of nasal endoscopy and imaging, CT or MRI, helps define extent and vascularity. But here's the catch. Biopsy is usually avoided unless absolutely necessary due to the risk of profuse bleeding. Management? Small, asymptomatic lesions might just be observed, but for larger or symptomatic cases, we go with surgical excision, often after preoperative embolization to minimize blood loss. Alternative approaches like laser therapy or sclerotherapy are sometimes considered in select cases. Key takeaway? Always keep nasal hemangiomas in your differential for vascular nasal masses, and remember, their benign nature doesn't mean they can't be clinically significant.